keep him going his first breath.
Oh, it's not due.
Hey, this is Hunter Swanson here with a skill video for RSI. As always, let's make sure that our scene is safe and we have proper PPE on. Let's talk about the indications for needing RSI. Of course, your monitor needs to show above 120 systolic for blood pressure and above 93% saturation for at least 3 minutes. Let's talk about what he's doing here. He's going to be pre-oxygenating our patient every 5 to 6 seconds with a bag valve mask. We have a simple OPA in there. We also have a nasal cannula flowing at 15 liters per minute. Let's do our med math. I have ketamine, I have fentanyl, and I have succinylcholine. PD has informed me that according to his driver's license, he weighs 220 pounds. Looking at our patient, I can verify that that is accurate. So, we have 220, which is going to be 110, take away 10%, we have 100 kilograms. So for cat, it's going to be 3. So we have 300 kilograms. For sucks, we have 2, which is going to be 200 milligrams. Post sedation, we have fent, which is going to be 1 mic. And we also have ketamine again, which is going to be 1 mic. So it's going to be 100 mics, 100 milligrams. I'm going to walk over to my RSI kit. Take my 3 vials here. Check the fentanyl, make sure it's not expired. Good, it's not. And our concentration is 50 mics per milliliter. So I can put 2 milliliters here. Our ketamine twist, look for expiration. No, it is not expired. We have 50 per milliliter there. So we're going to have 2 milliliters here, and we're going to have 6 milliliters up here. And for our sucks, make sure that it's not expired, and it is not. And it's going to be 20 milligrams per milliliter. So we're only going to need 10 milliliters here. Once my partner is done with the IV, I'm going to hand him the vials and make sure that they are not expired. Okay, ketamine is not expired. And then have him verify the med math when he is done.
Right, the med math looks great.
Okay, and none of these are expired?
They're not expired.
Okay.
They're all good.
I verify once more just to make sure that they're not expired. I'm going to drop my ketamine.
Sounds good.
Take my sterile syringe here. Take the bottle. This says ketamine. I'm going to put it in. And I'm going to draw up 6 milliliters. Okay, verify that that says 6. I'm going to drop my sucks here, which looks like it's going to be a full 10. Okay, verify that that says 10. Okay, and if you come over here, we can watch us do the ketamine push. We're going to push the ketamine very slowly. Okay, ketamine given at the 35-second mark. We will wait 1 minute until we give our paralytic.
It's not bad. It's fun.
Okay, 1 minute has elapsed. I can grab my sucks here, and I can push it slowly. Okay, given at the 45-second mark, And while I wait for this minute, we can verify that we have all of our equipment for intubation. I have my suction here, I have my properly sized blade and handle. We also have our backup kit in case our sizing fails. We have our backup airway just in case our intubation fails, which is the iGel. We have our tube tamer here. We have the properly sized tube, bougie, and syringe. And once this minute is done, my partner Seth here will remove the bag valve mask, and I will remove the OPA and we will suction our patient. But I will let him know when the minute has passed. Okay, the minute is up. Okay, OPA out, head tilt chin lift, going with the suction, use salad technique. Grab my blade, readjust our patient here, go in, lift up, I see the cords. I'm past the cords and I feel the rings. Okay. I have the tube. The tube is past the cords. Then you can go back on, Seth. And I see chest rise, so I can come up with the blade. I can come up with the suction. I can check epigastric here, and I can check lung sounds bilaterally, and I can see bilateral chest rise. I can come up here and see fogging in the tube, and I can look over my monitor and make sure that I see end tidal and I see SpO2 improvement. And I can also see skin improvement as well. Let's take a look at where we're at. We're about 23 at the teeth. We are go ahead and secure this airway. Okay, airway is secured. I can let go now and start drawing up my post-intubation medication. I have my fentanyl here. And just verify that it's not expired, and it is indeed fentanyl.
It is fentanyl and it's not expired.
Okay, I can go in and draw up 2 milliliters. Okay, if you want to make sure that that's 2 milliliters. And now I will go in my ketamine again, and I will draw up 2 milliliters. Okay, you want to verify that? Okay, I will give my fentanyl slowly. Okay, fentanyl is in. And I can give my ketamine slowly. While we're at it, we can just re-verify that we're not in the stomach with epigastric, bilateral lung sounds, bilateral chest rise, fogging in the tube, still 23 at the teeth, and the tube is secure. Verify that my partner is bagging adequately every 5 to 6 seconds. Make sure skin condition is improving. Make sure our end tidal is still ideal. Make sure our SpO2 is also ideal. And make sure that our cyanosis is improving. From there, you're good to go.